ये शरीर का एक ज़रूरी हिस्सा है। अगर टूट गया तो बन जाता एक किस्सा है। अगर काम बन गया तो ये मचल जाता है, और अगर काम बिगड़ गया तो ये यही पूरा दिन गाता रहता है।
ऐसा होता था नहीं, तू ही बता इस दिल का मैं अब क्या करूं।
हेलो एंड वेलकम टू द पब्लिक हेल्थ जोक बॉक्स, जहाँ समस्याएं आपकी, सॉल्यूशंस हमारे। आप सोच रहे होंगे कि ये जिल इतना दिल दिल क्यों कर रही है? क्योंकि जनाब, ये दिल है और सब इस दिल की ही मुश्किल है। वर्ल्ड हार्ट डे कुछ ही दिनों पहले चला गया। वो तो चला गया, लेकिन हार्ट डिसीजेस अभी भी है। तो आपकी इस समस्या का समाधान लेकर मैं आ गई हूँ। So let's begin with our discussion on cardiovascular disease strategies and prevention. So before this discussion, let me tell you the few informatics. That is, cardiovascular disease is a leading cause of death globally, and it is a group of disorders of heart and blood vessels that includes coronary heart disease, cerebrovascular disease, rheumatic heart disease, and other conditions. According to the World Health Organization statistics, 4 out of 5 cardiovascular disease deaths are due to heart attack and strokes. So out of 17 million premature deaths globally, 38% were caused due to cardiovascular diseases in 2019. There are a number of underlying determinants of cardiovascular diseases, and these are major reflections of major forces like driving social, economic, and cultural change, globalization, urbanization, and population aging, and other determinants of CVDs that includes poverty, stress, and hereditary factors. So here we go with our questions. So first is, generally whenever we talk about non-communicable diseases, it's always been told that early detection or early screening is beneficiary in preventing of the diseases or from getting it worsened. So what is the signs and symptoms, or what is the early screening detection for cardiovascular diseases? So first is chest discomfort. So discomfort in center of the chest that lasts for few minutes or that goes away or comes back. Second is discomfort in other areas of the upper body that may include pain or discomfort in both the arms, back, neck, jaw or stomach. And last is shortness of breath with or without chest discomfort. These are the mostly observed signs and symptoms. There is generally a misconception. Early screening and detection, that means that whenever we feel uncomfortable or we are not feeling well, we should consult our doctor. But generally we people ignore the signs and symptoms which are being there. Like for example, when we have a chest pain, we might think that okay, it is a gastric pain or it is due to some due to gas problem. It's not like a chest pain. So this is one of the main misconception. So at least we should consult the doctor for if you are suffering from any kind of the disease like hypertension, diabetes, dyslipidemia, hypercholesterol, any of the disease. So the next question is that food is a major component in all our lives. So इंसान के दिल का रास्ता उसके पेट से होकर गुजरता है. So how much this sentence is relevant? So we're going to talk about some nutrition. So it has been observed the most important behavioral risk factor for heart disease and stroke is unhealthy diet, physical inactivity, tobacco use, and harmful use of alcohol. So basically this includes lifestyle modification, and it begins with a healthy diet that includes plenty amount of fruit and vegetable intake, low sodium intake, then decreasing junk food, processed food, cessation of tobacco, smoking, less use of alcohol. Physical activity should be increased, especially for those who are obese and overweight and who don't do any kind of activity at all. Should begin with 15 to 20 minutes of physical activity and then gradually increase it till 60 minutes, or however they can do that. So the third and last question is how mental health and CVDs are interrelated to each other. So definitely yes, they are interrelated to each other, because we have seen in our lives that stress is the major component in everyone's life. Stress management is one of the most important thing which should be adopted. The major stress related issue is due to globalization and urbanization, where we are not able to manage the stress, and due to which we start panicking, we have anxieties, we have many mental health issues, and also many of the problems related to the heart. So if last thing which I would like to say in terms of public health perspective is, it is important to detect cardiovascular disease as early as possible so their management with counseling and medicines can begin. And for that, people need to consult their doctor immediately if they find something unusual or uneasy in their health, and should properly follow the diet, and should try to calm themselves, calm their body, so that they can work efficiently and the heart can work efficiently. Thank you.